Hey, it's Dr. Dan. We are so excited to have with us Tigger, Piglet, Eeyore, and Winnie the Pooh. Guys, thanks so much for coming on the show.
Thank you for having us.
So, how did you get interested in diabetes?
Christopher Robin told us he has diabetes and we want to help.
Before we jump into the topic, let's first talk about some anatomy as it pertains to diabetes. Here we have the digestive tract, esophagus, stomach, small intestine, large intestine, rectum, and out. Where we really want to focus is on the pancreas. The pancreas releases enzymes to break down food, but it also releases hormones into your blood to help control glucose.
What's glucose? Is that sugar? I love sugar.
Kind of. So when we refer to blood sugar, the sugar that we're talking about is glucose. Glucagon and insulin are hormones released from the pancreas. Glucagon helps raise your glucose and insulin helps decrease it by bringing it into your cells and having them use it for energy. Insulin is very important, so you can imagine it's a problem when things go wrong.
Why are there two types of diabetes? Isn't it you have it or you don't?
Good question, Piglet. Type 1 diabetes is when your body makes little to no amounts of insulin. This is autoimmune, meaning your body attacks the healthy tissues by mistake.
Ha! Attacking the wrong guy by a mistake.
Tigger, didn't you attack Eeyore by mistake last week?
Oh yeah, sorry old buddy old pal.
Type 2 diabetes is different because it's where you become insulin insensitive. As your blood glucose goes higher, you secrete more insulin. Insulin helps your cells use glucose and it goes down. But if your body is constantly secreting high amounts of insulin, then your body gets less responsive to the insulin you're producing. Your pancreas gets tired and produces less over time, and you can have dangerously high amounts of sugar in your blood. This is what's known as type 2 diabetes.
Oh dear. Sometimes I eat poos, honey. Probably more than I should. Do I have diabetes?
Probably not. A bunch of factors play a role in insulin resistance, one of the biggest being your BMI, your body mass index, which is why the obesity epidemic is so closely related with development of diabetes. However, not everyone with type 2 diabetes is overweight. Other factors such as family history, diet, activity level.
But how do you know, sir, you don't have diabetes?
So the normal glucose level is 70 to around 110. If your fasting glucose is greater than 200, then it's likely. However, the gold standard that we use is a test called hemoglobin A1C. So hemoglobin is a molecule that makes up your red blood cells, that carries oxygen. In this test, we basically look to see what percentage of those proteins in your blood have sugar on them. This is a really good test because we are essentially tracking your blood sugar over the past couple of months.
What number is diabetes? 20?
Above 6.5 is when you have type 2 diabetes. 5.7 to 6.5 is pre-diabetes.
Well, what's wrong with having too much sugar?
The reason why type 2 diabetes is such a problem is because of all the complications that it can cause. One, we have to have you go see an ophthalmologist every year to screen for retinal changes, have their urine checked for signs of kidney damage, have a yearly foot exam to check for nerve damage, and they need to check their feet daily. And because of an increased risk of heart attacks and stroke, we start them on a statin.
Oh dear, that sounds like quite a bit.
Diabetes can cause an increased risk of a lot of other problems as well, including infections, loss of limbs, and life-threatening situations.
Oh, bother.
I know all of this can sound like a lot. However, you can manage, prevent, and even cure diabetes. For type 1 diabetics, it does, because remember, your body is not making enough insulin. And for type 2, insulin we typically don't add unless a person's hemoglobin A1C is continually above 9 and they've been on 2 or 3 medications and haven't had improvement with that, as well as lifestyle and diet modifications.
One more question.
Yes.
Should I stop sharing my honey with Christopher Robin?
Can I see the label?
Sure.
The ingredients are just high fructose corn syrup.
Is that good?
No!